Welcome back. You're still tuned to Shape Your Life. And today the big topic is tuberculosis. Once you have been diagnosed with the disease and are going through treatment, it's important that you adjust your diet. Dietitian Monique gave some advice on what kind of food you should eat and the ones you should stay away from. Monique, thank you for joining us on Shape Your Life.
Thank you for having me.
Why is malnourishment associated with an increased risk of TB?
Okay, so if a patient's malnourished, they have a compromised immune system, and one of the things that you get with being malnourished is that because your immune system is compromised, you have a loss of protein and a loss of muscle wasting, and your system is just much more susceptible for diseases.
Now, is malnourished only associated with not eating enough food, or is it about the quality of food that you're also eating?
Very important, the quality of food, especially your protein intake. Sometimes people do not get enough protein in, and your big thing with your TB is your protein energy malnourishment that you get. So for a patient with TB, it's very important to eat sufficient amounts of proteins, but also to make sure that their macronutrient intake, their vitamins and their minerals that they're getting in from their fresh fruit and vegetables are sufficient on a daily basis.
Now, when it comes to treating someone with TB, food and nutrition is a critical component. They need to build up their resistance. They might have a loss of appetite from the medication they're taking.
Definitely.
How then should they eat to ensure that they boost that strength within themselves and their protein intake and their macro and micronutrients?
Okay, so with a TB patient, as soon as they go onto the medication, you would monitor their symptoms. Do they get diarrhea? Do they sometimes get a loss of appetite and stuff like that? And based on that, you would start formulating an eating plan for them that would suit their needs and they would be able to follow. Enough protein in the diet is very important, but also looking at the macronutrients that you start losing in your diet, especially vitamin D. Your vitamin D level can go very low, and sometimes it'd be worth supplementing with vitamin D. From the medication, you sometimes get loss of vitamin Bs, so a vitamin B supplement, or making sure that they get enough, if sufficient green vegetables in, and make sure their vitamin B intake is enough, as well as also a calcium intake. They can also get anemia quite easily from that. So it's all things that you would have to consider and look at when you work with a TB patient and their diet.
What about things like zinc and folate? Do they also play a key role, and how do we then bring them in to the diet?
Okay, so folic acid is very important. It's one of your vitamin Bs, and you get enough folic acid from taking, or not enough sometimes, but you can get your folic acid from taking your fruits and your vegetables. So you would try and boost that, okay? So you would teach a patient, that it's so important to get enough fruit and vegetables, but also with their fruit and vegetables, they have to be safe with that, so safety plays a role. Washing their vegetables, making sure their food is clean, and sometimes if patients are not sure about the vegetable and the type of vegetable they're getting and they need to wash it, they can also take 5 ml of bleach and put it in 1 litre of water and rinse their vegetables in that to make sure that it's clean sufficiently. Okay, and then the other thing you would also do with your TB patients to prevent the risk of diarrhea is to make sure they know about safe eating habits, making sure that your cold food is always cold, and that your food, if you reheat it, gets reheated at a hot temperature to ensure that they don't have any germs in it. Okay, and also to make sure that food stays in the fridge, that's very important, and that they make sure their eggs are not runny. The egg must be well cooked, as well as your meats and your fish, your proteins need to be very well cooked.
When it comes to literally protein, you mentioned that so many times in our discussion.
Yes, yeah.
What are the options that people out there have when it comes to protein intake, both the veggie options and of course the meaty options?
Okay, so your meat options, your chicken, your fish, your meat's always good options, and we try and include at least twice in a day. And then with breakfast, if you can, have your eggs and stuff like that. And then in terms of your vegetarian based options would more be from your legumes, and then your soya bean is your best based protein legume that you get.
We also know that being on TB medication, your appetite is totally suppressed. You have no appetite. So you literally end up wasting away and losing so much weight. What's your advice when it comes to literally increasing one's appetite, or do we have to force feed ourselves?
Well, I think force feeding unfortunately never really works. You kind of have to try and make sure that you want to be eating and that you enjoy your food. Otherwise, it's never nice to eat. But one thing that we tell the people is to eat small, regular meals, often, So because you don't have appetite, it's not good if you only eat 12 o'clock at the first time of your day. Start your day early and start with eating ASAP. When you wake up, try within the first hour to have a meal. And from there, have small meals regularly. Include your fruits as snacks, include some nuts as snacks, stuff like that can help you to just in a day get enough nutrients in.
Knowing that nourishing your body with the right macro and micronutrients is so important when it comes to TB, what food sources should we stay away from that don't add value to the nutritional quality of what we're putting into our bodies?
Okay, definitely your empty nutrients. So it would be sugars, refined foods, sweets, chocolates, and especially also before meals. You know, for your kids, if they have a sweet before meal, by the time they have their meal, they're just not going to want to eat. You know, and then there's no force feeding that will work with that. So it's very important for kids to say their meal is the most important part, and to have a sweet or a chocolate or something like that would be a treat more for here and there, and not on a daily basis.
For people that can also afford supplementation, some might go for meal replacement shakes or fortified protein shakes or vitamins and minerals. Would you advise that?
Yes, there's definitely a place for it. I think you get very good, multivitamins out there. A multivitamin or a vitamin D or a calcium supplement or a vitamin B, that's very good to take. It would be best to speak to your doctor or your dietitian when deciding on which one to use. And then I think in terms of a shake, and also for kids, sometimes that's something nice to do. You get very good nutritional shakes out there, both for adults and for pediatrics, that can just benefit them.
Would you advise them to first go to their doctors and their dietitians when it comes to any form of supplementation or any of these meal replacement shakes that are out there?
Yes, I definitely think you would have to, go do that in conjunction with your doctor or your dietitian, especially also because there's so many types out there. You can stand in front of those shelves and just not know which one would be the best one for you to take.
What is your final pearl of wisdom to our viewers out there when it comes to food intake and managing and beating TB?
Definitely to keep your nutritional status up, eat enough protein, and make sure you don't lose unnecessary weight.
Monique, thank you so much for joining us once again on Shape Your Life.
Thank you.
TB and HIV-related illnesses were the two leading causes of death amongst young people in 2013. These were details released by Statistics South Africa. This is devastating news, and TB can be defeated if we get the right information. We had a chat with Dr. Mpumi from Helen Joseph TB Center, who taught us about how we can help beat the silent killer disease. Doctor, thank you for joining us on Shape Your Life. What is tuberculosis?
It's a disease that is caused by a mycobacterium infection that affects the lungs, or that we get through our lungs.
Doctor, what are the signs and symptoms of TB?
It's usually coughing and fever or drenching night sweats, whereby a person has to change their pajamas or even change their bed linen at night. And then the person loses weight, they lose appetite, and sometimes they've got chest pains. Sometimes when they're coughing, they produce sputum that has got blood. So those are the main symptoms that TB can cause, but there are other symptoms that TB can cause.
What is the difference between active and latent TB?
Active TB is when you are already sick. Latent TB is what we all have, because we all have inhaled the TB bug. It's sitting somewhere in our lungs, waiting for our immune system to go down and then reactivate.
What are the different types of TB?
The drug-sensitive TB, which is the one that most patients know of, which is treated with a shorter course of treatment, about 6 months. And then we've got the drug-resistant TB, which can be one drug that is resistant to the TB, like your rifampicin or your INH, the first-line drugs that we use. And then there is MDR TB, which is multi-drug resistant TB, whereby the person is resistant to the most important two drugs or strong drugs that treat TB, your rifampicin and your INH. And then you have got your XDR TB, whereby you are even resistant to some of the second-line drugs that are being used, like your injectables and your ofloxacillins.
So when a patient comes to you and they say they've been showing signs that you mentioned earlier, the coughing, the blood in the sputum, the excessive night sweats and fever, etc., what tests would you conduct to identify if they have TB or not, and then what type of TB?
In most cases, we usually prefer to do the sputum if the patient is coughing. We do a test that is, you can get a result within 2 hours. You cough into a Berkeley and the test goes into the laboratory, like ours, the local on-site laboratory, where the sputum is run through the machine, and then it gives you an answer whether the patient has got TB and is it drug sensitive or drug resistant TB, because it is very important nowadays to know whether you're dealing with drug sensitive or drug resistant TB.
When it comes to a very simple question that many people want to know the answer to, is TB curable?
TB is curable. If you take your treatment correctly and finish the course of TB, you'll be cured of TB.
Doctor, thank you so much for joining us on Shape Your Life. But you have inspired me to actually go and get myself tested right now in your laboratory with you, because I trust your expert knowledge and your expert hands for the right advice.
You can come along and we provide your sputum and we check and you'll know your results in 2 hours.
Let's go. Remember, when you have a cough that lasts for more than 2 weeks, don't take it lightly. Go for your TB screening. I decided to lead by example and screen for TB as well. Knowing if you have the disease can help you and the people close to you from being infected.
Come and do your sputum here in the induction room, because we don't want you to infect the other patients. This is a reception area. We don't want you spreading the TB as you're coughing to infect other patients. So you're gonna sit here and face that direction, and then you open your specimen box and try and cough and make sure that you're coughing from your chest, not from the throat, because we need the sputum from your chest. Bridget is going to be doing our running our Gene Expert. She's going to do the processing of the sample, and then after 2 hours we'll be able to get Aaron's results. It does happen that in some instances the patient cannot cough, they cannot produce the sputum, especially those who are very sick with a very low CD4 count. What we normally do is we get a urine specimen and test the urine specimen for the Mycobacterium. It tests for the cell wall of the Mycobacterium in the urine, and if the patient is the test is positive, then it means the patient has got disseminated TB. So what we do is we use this test. It's called a urine LAM. It's more like a pregnancy test, whereby you put the urine and then you wait for about 20 minutes in order to get your results. So this one is even much faster. But we use it specifically for those patients that have got a very low CD4 count and cannot produce the sputum. So just like a pregnancy test, we look for 2 lines. If the test has got 2 lines, as shown here, this one is the control and that one is the positive one. So it means the patient has got a TB. The other one has got 1 line and the other one is negative. So it means the patient doesn't have the disseminated TB. Hi Ronald, we've got your TB results.
South Africa has one of the highest incidences of TB in the world. And if you are diagnosed with TB, all you need to do to beat the disease is stick to your medication for the prescribed time period. From me, Ronald Avergy, and the Shape Your Life team, see you next week.